Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, we are going over to London and my guest will be Mandy Sanghera. She's a well-known philanthropist and international human rights activist. She is a TEDx speaker and she's a mentor and she is a member of various committees of the United Nations. She has had the privilege to speak in the United Nations and also in the world's parliaments, and her focus is on important issues that affect us all. So today it's a great pleasure to have her on the program and we'll be talking on a very important issue. What is the impact of culture on our health? This will be our focus. So let's go over to Mandy and continue with our discussion. Mandy, welcome to the program.
Welcome. It's great to be back and good to see you, Harpreet.
Thank you very
you
much.
for having
Thank
me
you.
on again.
So Mandy, COVID has been a pandemic, has changed everything. How have you kept yourself busy during this period? What all has been going on?
So it's been a very busy year. So actually, in March last year, I was stuck in America in New York, and England ended up in a lockdown. I ended up flying back, and I've been stuck in the UK. As you know, I'm somebody that travels the world all the time doing talks and events. But luckily, I've been able to do these events online and continue to do all the events remotely. So I've learned to use a lot of tech and do different things. So it's been a very busy year, and I've been able to do all the things I was going to do before Harpreet. So brilliant. Thank you.
So, Mandy, you are a vocal person who talks on various issues. Now, when we talk about COVID, that has had a great impact on people's lives. Not only mentally, physically, but emotionally also people have been shattered. And despite the vaccine out now, still people are still threatened and the new variants are creating more crisis. So tell us, when we talk about health as such, and what impact does the culture have on health? So explain in details, what do you mean by the impact of culture on our health?
Okay. So today I just did an event at the University of Central London, and I just done an event with 130 young medical students from across the UK. And we were looking at, in the UK, we have realized, and it's that there are inequalities. If you are Asian or Afro-Caribbean or a person from the BME community, there is a chance that you can die sooner than, say, an English person. And this is something that is an inequality. But what we have realized is we have people working in the front line as medical doctors and nurses, working on the front line in stores and supermarkets, working in pharmacies and other things like that. Or they're working as cleaners and they're working there. So we know that that's an issue. There's also an issue where we live in nuclear families. People live in very extended families and actually overcrowding. We also realize that there is a lot of poverty still, and actually people are not being paid the same. So we know that newly arrived communities sometimes don't access health services appropriately. So, for instance, when we look at women's health and well-being, during the pandemic, women have been too scared to go and report for help or access health services at Harpreet. And that is not just in the UK, that has been a global issue. And then one of the other issues, what has happened is there's been two other pandemics. The first has been a shadow pandemic of domestic violence, which is a real issue within our Punjabi and not just the Punjabi community, but around the world. In the UK, we have seen, a rise in domestic violence and against forced marriages and other violences. There's also been another pandemic, a third one, which is around mental health and well-being. And actually, we also realize that this is another pandemic in around the world where people are staying at home. They've lost their jobs, maybe. People are anxious. People are suffering with depression, feeling isolated. So there has been all these extra pandemics that have been in the shadow. So these are some of the things that I've been working on and been globally talking about.
Right. So the most important, I would like to just focus on this aspect that faith and culture affect on abuse also. And you talked about domestic violence. And if we see the statistics all over the world, it shows that women are more affected and impacted by this pandemic than anybody else. Can you elaborate on this as to what have you found out and what are the reasons behind this?
Okay. So what we have realized is that a lot of women who may be self-employed before. So we know this in America, in Canada, and in the UK, and all around the world, run small businesses, and actually they have been the first that have been hit. So women have financially fallen, behind on, financially and economically really have fallen behind. And some women have ended up managing a lot of responsibilities of caring, teaching children, and also looking after elderly in-laws and things like that. But what has also happened is where there was already issues around alcoholism within our community, where domestic violence was already an issue before the pandemic, it has actually, 10 times it's increased, if not more, around the world, because people are locked at home with their perpetrators. We're still on a lockdown in the UK, we're on another lockdown. And what's happening is people are too scared to go and ask for help. We have an initiative in the UK now where we've got code words. If people come to a pharmacy, we can try and get them help. But the people are stuck at home with their perpetrators, and actually they are being not just physically abused, but emotionally and sexually, and there is so much abuse happening behind closed doors. Also, sometimes we have women that have come from India and other countries who don't know their rights. Sometimes they're on spouse visas or they don't have very secure immigration status, and they are also very vulnerable. There's also issues because these women end up falling into the category of having no recourse to public funds. So that means they cannot have any benefits. But in the UK, thank God, we have something called the National Health. But we know in other parts of the world, there is no such thing as having free healthcare, because actually there is a thing where if people have lost their jobs, people have lost, their businesses, they're struggling to survive financially, people have not been able to pay for their Medicare or their health insurance, and now are falling further behind, and people's health is now deteriorating worse. And these things have come to the surface like never before.
So what kind of support, Mandy, is available for those who are suffering from domestic violence and abuse? Where can they go forward? And in England or in other countries also,
Even in Canada, yeah. So what it is, these refugees and these women organisations are here. In the UK, we have put in millions, tens of millions of pounds to support civil society, to support. Like I just said to you, the pharmacies now are supporting people. Because actually what it is, because like I said, we're on a lockdown, and what we're realising is sometimes people will still go to the pharmacy to get medication to say they're not feeling well. They'll go to the GP practice. So we are still continuing to train frontline staff, trying to educate pharmacy, the police and other first responders to recognise the signs. And also we are trying to say to people, look, if you need help and you're in a dangerous situation, you need to ask for help. Do not be just scared thinking, because it's COVID, I don't want to ask for help because I'm worried about the already stretched services. I'm already worried about not being able to get the support because somebody else might. So it's really important that we look at empowering people, and also the community has a role to play, Harpreet. I think, if we see something, so like in Canada where you are right now, if somebody in your basement is being abusive, and you as the landlord, or if you are, living the other way around, that you have a responsibility to step in and say, look, this is not right. This is not, acceptable behavior.
Right.
And the thing is, parents don't want to get involved because they think, it's not my business. But Absolutely. We have to make it our business, especially when there's children in the house, because children are also victims of abuse.
That's a very important point you have raised, Mandy. It's time for a break. We'll go for a break and come back. And when you talk about women empowerment, and we are living in the 21st century, everybody's equal. But despite that, why do you feel that mentality is not changing? Whether the abuse is from both the sides, that's what we have seen. But the majority of the time it is on women. So what do you think, despite all this work that is being done, how much dent is being made on this particular aspect? We'll learn from you after this short break.
ਕੀ ਤੁਸੀਂ ਸਰੀ, ਡੈਲਟਾ, ਰਿਚਮੰਡ, ਐਬਸਫੋਰਡ ਜਾਂ ਵੈਂਕੂਵਰ ਵਿੱਚ ਨਵਾਂ ਘਰ ਬਣਾਉਣ ਬਾਰੇ ਸੋਚ ਰਹੇ ਹੋ, ਜਾਂ ਫਿਰ ਪੁਰਾਣੇ ਘਰ ਨੂੰ ਰੈਨੋਵੇਟ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ? ਤੁਹਾਨੂੰ ਲੋੜ ਹੈ ਇੱਕ ਤਜਰਬੇਕਾਰ ਬਿਲਡਰ, ਇੱਕ ਕ੍ਰੀਏਟਿਵ ਇੰਟੀਰੀਅਰ ਡਿਜ਼ਾਈਨਰ ਦੀ, ਜੋ ਤੁਹਾਨੂੰ ਸਹੀ ਤਰ੍ਹਾਂ ਗਾਈਡ ਕਰ ਸਕਣ ਤੇ ਤੁਹਾਡੇ ਸੁਪਨੇ ਦੇ ਘਰ ਨੂੰ ਉਸਾਰ ਸਕਣ। ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ ਹਰਪ੍ਰੀਤ ਜਾਂ ਸੰਦੀਪ 6048259295 ਉੱਤੇ।
ਛੋਟੇ ਘਰਾਂ ਤੋਂ ਲੈ ਕੇ ਵੱਡੇ ਪ੍ਰੋਜੈਕਟਸ ਤੱਕ ਬਾਹਰੋਂ ਸ਼ਿੰਗਾਰਨ ਲਈ ਮਸ਼ਹੂਰ ਹਨ ਜੇਰੇ ਸਟੋਨ ਕੰਪਨੀ ਵਾਲੇ। ਘਰ ਨੂੰ ਟ੍ਰੈਡੀਸ਼ਨਲ ਕੰਟੈਂਪਰੇਰੀ ਜਾਰਜੀਅਨ ਮਾਡਰਨ ਲੁੱਕ ਦੇਣੀ ਹੈ ਤਾਂ ਕਾਲ ਕਰੋ ਜੇਰੇ ਸਟੋਨ ਨੂੰ, ਜੋ ਆਪਣੇ ਕਾਬਲ ਸਟਾਫ ਨੂੰ ਭੇਜ ਕੇ ਫ੍ਰੀ ਐਸਟੀਮੇਟ ਦੇਣਗੇ। ਸਟੋਨ ਟਾਈਲਸ, ਅਰਬਨ ਸਟੋਨ, ਮੋਲਡਿੰਗਸ, ਐਕਸੈਸਰੀਜ਼, ਪਿਲਰਸ ਆਦਿ ਨੂੰ ਇੰਸਟਾਲ ਕਰਨ ਵਿੱਚ ਇਹ ਮਹਾਰਤ ਰੱਖਦੇ ਹਨ। 25 ਸਾਲ ਦੀ ਵਾਰੰਟੀ, ਮੇਨਟੇਨੈਂਸ ਫ੍ਰੀ, ਗਵਰਨਮੈਂਟ ਅਪਰੂਵਡ ਟਾਈਲਸ ਦੀ ਵਰਤੋਂ ਕਰਕੇ ਜ਼ਰੂਰ ਵੇਖੋ। ਕਾਲ ਕਰੋ 6046149231 ਜਾਂ ਫਿਰ ਵਿਜ਼ਿਟ ਕਰੋ ਯੂਨਿਟ ਨੰਬਰ 500, 1515 ਬ੍ਰੌਡਵੇ ਸਟਰੀਟ, ਪੋਰਟ ਕੁਕਟਲਮ।
ਕੁਦਰਤ ਦੇ ਸੌਮਿਆਂ ਦੀ ਵਰਤੋਂ ਆਯੁਰਵੇਦਾ ਰਾਹੀਂ 5000 ਸਾਲਾਂ ਤੋਂ ਚੱਲਦੀ ਆ ਰਹੀ ਹੈ ਤੇ ਹੁਣ ਕੈਨੇਡਾ ਵਿੱਚ ਹੀ ਬਣਾਏ ਗਏ ਹੈਲਥ ਕੈਨੇਡਾ ਵੱਲੋਂ ਅਪਰੂਵਡ 100% ਸ਼ੁੱਧ ਆਯੁਰਵੈਦਿਕ ਡਾਇਟਰੀ ਸਪਲੀਮੈਂਟਸ ਦਾ ਲਾਭ ਲੈ ਸਕਦੇ ਹੋ। ਸਟ੍ਰੈਸ, ਐਂਗਜ਼ਾਇਟੀ, ਇਨਸੋਮਨੀਆ, ਬਲੱਡ ਸ਼ੂਗਰ, ਕਿਡਨੀ, ਬਲੈਡਰ, ਹਾਜ਼ਮਾ, ਆਈਸਾਈਟ ਜਾਂ ਕਿਸੇ ਵੀ ਕਿਸਮ ਦੀ ਬਿਮਾਰੀ ਦਾ ਆਰਗੈਨਿਕ ਇਲਾਜ, ਜੋੜਾਂ ਦੀਆਂ ਦਰਦਾਂ ਤੇ ਸਰੀਰਕ ਮਸਾਜ ਲਈ ਕਈ ਕਿਸਮ ਦੇ ਆਯੁਰਵੈਦਿਕ ਤੇਲ ਵੀ ਉਪਲਬਧ ਹਨ। ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਲਈ ਕਾਲ 604 628 2003।
ਸਵਾਗਤ ਕਰਦੇ ਹਾਂ ਜੀ ਇੱਕ ਵਾਰ ਫਿਰ ਆਪ ਸਭ ਦਾ ਅੱਜ ਦੇ ਇਸ ਪ੍ਰੋਗਰਾਮ ਵਿੱਚ। ਪ੍ਰੋਗਰਾਮ ਤੁਹਾਡੇ ਤੱਕ ਪਹੁੰਚਾਇਆ ਜਾ ਰਿਹਾ ਡੇ ਟੂ ਡੇ ਹੋਲਸੇਲ ਕੈਸ਼ ਐਂਡ ਕੈਰੀ ਵੱਲੋਂ। BC ਦਾ ਸਭ ਤੋਂ ਵੱਡਾ ਸਾਊਥ ਏਸ਼ੀਅਨ ਗਰੋਸਰੀ ਸਟੋਰ ਹੈ, ਜਿੱਥੇ ਤੁਸੀਂ ਗਰੋਸਰੀਜ਼, ਪਾਰਟੀ ਵੇਅਰ, ਕਿਚਨ ਵੇਅਰ, ਹੋਮ ਵੇਅਰ, ਪੂਜਾ ਦਾ ਸਮਾਨ ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਤੇ ਖਰੀਦ ਸਕਦੇ ਹੋ। 5000 ਤੋਂ ਵੱਧ ਪ੍ਰੋਡਕਟਸ ਸ਼ੈਲਫਸ ਤੇ ਡਿਸਪਲੇਡ ਹਨ। ਫॉर ਬੈਸਟ ਪ੍ਰਾਈਸਿਸ, ਯੂਨੀਕ ਗਰੋਸਰੀ ਬਾਇੰਗ ਐਕਸਪੀਰੀਅੰਸ ਐਂਡ ਹਾਈ ਕੁਆਲਿਟੀ ਪ੍ਰੋਡਕਟਸ, ਕਾਲ 6045038787 604 503 8787 ਜਾਂ ਵਿਜ਼ਿਟ ਕਰੋ ਤੁਸੀਂ 7843 128 ਸਟਰੀਟ ਸਰੀ, 7843 128 ਸਟਰੀਟ ਸਰੀ। ਪ੍ਰੋਗਰਾਮ ਤੁਹਾਡੇ ਤੱਕ ਪਹੁੰਚਾਇਆ ਜਾ ਰਿਹਾ ਬੈਸਟ ਹੋਮ ਕਿਚਨ ਕੈਬਨਿਟਸ ਦੇ ਸਹਿਯੋਗ ਨਾਲ। ਘਰ ਦੀ ਸ਼ਾਨ ਹੁੰਦੀ ਹੈ ਕਿਚਨ ਤੇ ਇਸ ਨੂੰ ਸੋਨਾ ਬਣਾਉਣ ਵਿੱਚ ਬੈਸਟ ਹੋਮ ਕਿਚਨ ਕੈਬਨਿਟਸ ਲੋਅਰ ਮੇਨਲੈਂਡ ਵਿੱਚ ਇੱਕ ਜਾਣੀ ਪਛਾਣੀ ਕੰਪਨੀ ਹਨ। ਕਸਟਮ ਹਾਈ ਐਂਡ ਘਰਾਂ ਤੋਂ ਲੈ ਕੇ ਮਲਟੀ ਯੂਨਿਟ ਪ੍ਰੋਜੈਕਟਸ ਇਹ ਕਰਦੇ ਨੇ। ਹਰ ਤਰ੍ਹਾਂ ਦਾ ਸਪੈਸ਼ਲ ਕੈਬਨਿਟ ਦਾ ਕੰਮ ਕਰਾਉਣ ਲਈ ਬੈਸਟ ਹੋਮ ਕਿਚਨ ਕੈਬਨਿਟਸ ਨੂੰ ਯਾਦ ਰੱਖੋ। ਕਾਲ ਕਰੋ ਸੁਰਜੀਤ ਤੇਸੀ 6045918171 604 591 8171। Today we are talking to Mandy Sanghera, who is an international human rights activist, a speaker, and our focus is how culture impacts our health, and especially during this pandemic, what all is happening. We are talking to her about the kind of abuse which women have to face staying at home. So Mandy, before the break, what I was asking you was, what do you feel as far as the mentality of the persons is concerned? How much dent are these kind of conferences or this kind of talk is being able to have an effect on their mentality, or you still see that mentality, and especially when it comes to different cultures, and when it comes to the South Asian culture or any other culture, there's still that male chauvinism is still there?
Yeah. Well, that's a really good question, and thank you for asking it. And the problem is that we are still fighting misogyny, and we are still tackling so many inequalities within the South Asian community. And even though there are women like myself who have done quite well and, are leading the way globally, we know that actually, we are a small minority. But then one of the things that I'm doing is that I'm very passionate about is actually helping other people by creating opportunities, giving other people a voice, lifting other people up, giving them an opportunity. And what we have to do is, after this pandemic, when we come back to normality, and support women, support their businesses, try and help them back. And actually, if we see something, we have a responsibility as a collective to try and help them. There are some good initiatives, but also we need organizations to look at how they can support women better. It's really, really important that we do that.
Okay. The second aspect that you pointed out was still there is some kind of discrimination with the level of care people of color are facing. And that is a major impact of that culture on the health. So can you please elaborate on this as to how you are finding this kind of issue and what is being done to cater to this?
Okay, so one of the things that we have realized that actually not just in the UK but around the world, that people are not always understanding of other people's cultures and not understanding of like people's dietary needs. So sometimes, like to me, I've now become vegan because that's a choice. But actually when people go into hospitals or they need care, they don't always get their rights respected. Sometimes people may be Jehovah Witnesses in our community. People might, be vegan or vegetarian, or they might eat halal meat. It's so important that people understand and are tolerant and understand that. But also one of the things, like I touched upon earlier, sometimes we don't eat very healthy, Harpreet, in our community. We eat a lot of fried food. We eat, like a lot of butter and stuff in our food. And then what happens is, in our community, heart disease, diabetes, high blood pressure, all these things are very common in our community. And it's about education. It's about educating our elders to look at walking and doing a little bit of exercise. And during this pandemic, even though we're on a lockdown, we should encourage people to stay mobile, because actually what's happening is we think we're being kind by saying, oh, just stay home, it doesn't matter, just sit there, it doesn't matter. But actually we are, not helping our elders, we're not helping our family members. So it is not just about the physical health, but actually also around mental health. We need to recognize that it affects 1 in 4 people. People are suffering with anxiety, depression, and other illnesses. And we need to talk about these. Instead of just calling people horrible names, it's important that we actually address these issues globally and try and educate our community, because this is what it comes down to. So people like you, who are a great, source of getting messages out to the community, it's really important that we talk about our well-being. We bring on people that can educate. And I just saw something that you just shared, an advert about somebody talking about, eating healthy and, somebody doing vitamins and things. So it's really important that we share those messages.
Right. And also, Mandy, are enough efforts being made at the government level to provide cultural or language sensitive information?
I mean, they're trying. And the thing is, we have a lot of myths here in the UK right now with having the vaccination, because there are messages going around to say, oh, it's not vegetarian, oh, it's got this. And there's a lot of myths. So we have got some great doctors and people who are trying to educate. And there's a COVID task force trying to send culturally sensitive information out to the community. And we're trying to educate our elders that you need to have this vaccine. It is so important. If you do not take it, and there are conspiracy theories, but it's also our responsibility to support our parents to understand. It's our responsibility to educate our grandparents or our aunts and people who may not understand. We have a responsibility that this is not it's a global pandemic, not just against our community. So
Absolutely.
I think we all have a role to play.
Absolutely. And even Canada also, it's a good sign that a COVID task force has been initiated here also, which is providing culturally sensitive information, as well as young students have formed a foundation called Sikh Health Initiative, by which they're going to the gurdwaras and teaching our elders as to how they need to wash their hands, how they need to wear the mask, and what is the importance of that. And especially right now, when, as you very rightly mentioned, that mixed signals are being given in the community as far as the vaccine is concerned. So there are a lot of anti-vacciners who have come forward, and they are talking about the negative impacts which these medicines can have. But at a global level, at every level, in every country, wherever the communities who are culturally sensitive, they are living over there, if they start taking these initiatives, that definitely can have a good impact over there. So when you talk about this kind of information over there, you go around, you talk, and especially now webinars are held, you are interacting with youngsters also. Yeah. So how is that message percolating down, and what impact is it having?
So, I mean, I'm using people who are, the experts in the field, because I'm not claiming to be the expert on everything. And also, to me, I know the power that I bring, which I know with all the thousands of followers I have, I know that my words have power and influence. So I have to use it for social good, that's what I do. Right. And then it's also about bringing the right people in. So it's also bringing in people who might be members of parliament, councillors, or people in leadership to say, look, if you've had the injection, show people it didn't hurt. You know what? It's okay. And it's about these simple messages. So somebody like you, if you were to have the vaccine and you showed people, look, I've had it, and you had your camera crew there, then people might be more inclined to do it. But it is very important that we're all in this together. Right. And actually, as we come through this pandemic, and also, we cannot ignore the economic impact on our community, Harpreet. Right. Because in Canada, a lot of people are self-employed. You're lucky that, in Britain, we have gone over 100,000 deaths. Our death have been absolutely horrendous. And there's been a lot of failings, but we have to now come through this together. We need to educate and work and look at finding solutions. And it's not a blame game, but actually we're all in this together. Absolutely. We need to come out of this and hopefully get back to some sort of normality.
Great. Mandy, it's again time for a break. We'll come back after this break. And then I would like to touch upon the third aspect that you mentioned about the mental health and well-being, what needs to be done to be taken care of during this pandemic, especially on this particular aspect. So we'll be shortly back and continue with our discussion.
ਭਾਰਤ ਪੈਸੇ ਭੇਜਣੇ ਹੋਣ ਜਾਂ ਫਿਰ ਮੰਗਵਾਣੇ ਹੋਣ ਤੇ ਯਾਦ ਰੱਖੋ ਪੰਜਾਬ ਫੋਰੈਕਸ ਨੂੰ ਤਸੱਲੀਬਖਸ਼ ਸੇਵਾਵਾਂ ਅਤੇ ਵਧੀਆ ਰੇਟ ਦੇਣ ਦੀ ਇਹ ਗਾਰੰਟੀ ਕਰਦੇ ਹਨ। ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ 6043491313 ਉੱਤੇ।
ਲੈਣਾ ਚਾਹੁੰਦੇ ਹੋ ਨਵੇਂ ਤੇ ਵਧੀਆ ਅਪਲਾਈਐਂਸਸ ਜਿਵੇਂ ਕਿ ਸਟੋਵ, ਅਵਨ, ਫ੍ਰਿਜ, ਵਾਸ਼ਰ ਡਰਾਇਰ, ਮਾਈਕ੍ਰੋਵੇਵ, ਫ੍ਰੀਜ਼ਰਸ ਜਾਂ ਡਿਸ਼ਵਾਸ਼ਰ ਤਾਂ ਫਿਰ ਪਹੁੰਚੋ ਪ੍ਰੀਮੀਅਮ ਅਪਲਾਈਐਂਸਸ ਤੇ। ਇਹਨਾਂ ਦੀਆਂ 3 ਬ੍ਰਾਂਚਸ ਸਰੀ, ਐਬਟਸਫੋਰਡ ਤੇ ਚਿਲਵੈਕ ਵਿੱਚ ਹਨ। ਇੱਥੇ ਤੁਹਾਨੂੰ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਅਪਲਾਈਐਂਸਸ ਮਿਲਣਗੇ। ਇਹ ਡਿਲੀਵਰੀ ਤੇ ਇੰਸਟਾਲੇਸ਼ਨ ਵੀ ਕਰਦੇ ਹਨ। ਸਪੈਸ਼ਲ ਪੈਕੇजेस ਫॉर ਬਿਲਡਰਸ ਐਂਡ ਹੋਮ ਓਨਰਸ। ਕਾਲ 6045904140 604 590 4140। ਸ਼ਾਈਨ ਫੈਮਿਲੀ ਡੈਂਟਲ ਕਲੀਨਿਕ ਡਾਕਟਰ ਸਤਪ੍ਰੀਤ ਸਿੰਘ ਦੀ ਦੇਖਰੇਖ ਹੇਠ ਆਧੁਨਿਕ ਮਸ਼ੀਨਾਂ ਦੀ ਵਰਤੋਂ ਨਾਲ ਤੁਹਾਡੇ ਦੰਦਾਂ ਦੀ ਸਹੀ ਕੇਅਰ ਕਰਦੇ ਹਨ। ਇਹਨਾਂ ਦੀ ਸੇਵਾਵਾਂ ਵਿੱਚ ਦੰਦਾਂ ਨੂੰ ਸਾਫ਼ ਕਰਨਾ, ਕਰਾਊਨਸ, ਬ੍ਰਿਜਸ, ਡੈਂਟਲ ਇੰਪਲਾਂਟਸ, ਰੂਟ ਕਨਾਲ, ਡੈਂਚਰਸ, ਬੌਂਡਿੰਗ ਅਤੇ ਵਨੀਰਸ, ਐਕਸਟ੍ਰੈਕਸ਼ਨਸ, ਬੋਨ ਕ੍ਰੈਫਟਿੰਗ ਆਦਿ ਸ਼ਾਮਲ ਹਨ। ਬੱਚਿਆਂ ਦੀ ਡੈਂਟਿਸਟਰੀ ਦੇ ਵੀ ਮਾਹਰ ਹਨ। ਇਹ ਇੰਸ਼ੋਰੈਂਸ ਕੰਪਨੀਆਂ ਨੂੰ ਡਾਇਰੈਕਟਲੀ ਬਿੱਲ ਭੇਜਦੇ ਹਨ ਤੇ ਤੁਹਾਨੂੰ ਘੱਟ ਤੋਂ ਘੱਟ ਚਾਰਜ ਕਰਨ ਦਾ ਵਾਅਦਾ ਕਰਦੇ ਹਨ। ਫॉर ਸਪੈਸ਼ਲ ਸ਼ਾਈਨ ਐਂਡ ਸਮਾਈਲ 604 503 0320 ਤੇ ਕਾਲ ਕਰੋ। ਕਿੰਗ ਜਾਰਜ ਸੁਪਰ ਸਟੋਰ ਦੇ ਕੋਲ, ਯੂਨਿਟ 370, 7488 ਕਿੰਗ ਜਾਰਜ ਬੁਲੇਵਾਰਡ, ਸਰੀ। ਅੱਜ ਦਾ ਇਹ ਪ੍ਰੋਗਰਾਮ ਤੁਹਾਡੇ ਤੱਕ ਪਹੁੰਚਾਇਆ ਜਾ ਰਿਹਾ ਹੈ ਅਗਨੀਹੋਤਰੀ ਇਮੀਗ੍ਰੇਸ਼ਨ ਕੰਸਲਟਿੰਗ ਦੇ ਸਹਿਯੋਗ ਦੇ ਨਾਲ। ਟੈਂਪਰੇਰੀ ਸਟੇਟਸ ਬਾਰੇ ਗੱਲਬਾਤ ਕਰਨੀ ਹੈ, PR ਬਣਨਾ ਚਾਹੁੰਦੇ ਹੋ, ਨਵੇਂ ਹੋ ਕੈਨੇਡਾ ਵਿੱਚ, ਅੰਤਰਰਾਸ਼ਟਰੀ ਵਿਦਿਆਰਥੀ ਹੋ, ਸਿਟੀਜ਼ਨਸ਼ਿਪ ਬਾਰੇ ਗੱਲਬਾਤ ਕਰਨੀ ਹੈ, ਹਾਇਰ ਕਰਨੇ ਫੋਰਨ ਵਰਕਰਸ, ਐਕਸਪ੍ਰੈਸ ਐਂਟਰੀ ਬਾਰੇ ਜਾਣਕਾਰੀ ਲੈਣੀ ਹੈ ਜਾਂ ਫਿਰ ਸਪਾਂਸਰ ਕਰਨੇ ਪੇਰੈਂਟਸ ਜਾਂ ਗ੍ਰੈਂਡ ਪੇਰੈਂਟਸ ਤਾਂ ਤੁਸੀਂ ਗੱਲਬਾਤ ਕਰ ਸਕਦੇ ਹੋ ਨੀਰਾ ਅਗਨੀਹੋਤਰੀ ਨਾਲ। 2006 ਤੋਂ ਇਹ ਸਰਟੀਫਾਈਡ ਇਮੀਗ੍ਰੇਸ਼ਨ ਕੰਸਲਟੈਂਟ ਵਜੋਂ ਕੰਮ ਕਰ ਰਹੇ ਨੇ। ਤੁਹਾਨੂੰ ਓਨੈਸਟ ਤੇ ਰਿਲਾਇਬਲ ਇਨਫੋਰਮੇਸ਼ਨ ਦੇਣਗੇ ਕਿ ਕਿਸ ਤਰੀਕੇ ਨਾਲ ਲੀਗਲੀ ਤੁਸੀਂ ਕੈਨੇਡਾ ਵਿੱਚ ਆ ਸਕਦੇ ਹੋ ਤੇ ਇੱਥੇ ਜੇ ਪਹੁੰਚੇ ਹੋਏ ਹੋ ਤੇ ਕਿਹੜੀਆਂ ਚੀਜ਼ਾਂ ਨੂੰ ਇਸਤੇਮਾਲ ਕਰਕੇ ਤੁਸੀਂ ਇੱਥੇ ਪਰਮਾਨੈਂਟ ਹੋ ਸਕਦੇ ਹੋ। 6045972284 604 597 2284 ਇਹਨਾਂ ਦਾ ਫੋਨ ਨੰਬਰ ਹੈ। ਸਾਡੇ ਅਗਲੇ ਸਹਿਯੋਗੀ ਹਨ AMC ਇੰਸ਼ੋਰੈਂਸ। ਹੋਮ, ਆਟੋ, ਟਰੈਵਲ, ਬਿਜ਼ਨਸ, ਲਾਈਫ ਜਾਂ ਰਿਕ੍ਰੀਏਸ਼ਨਲ ਇੰਸ਼ੋਰੈਂਸ ਲੈਣ ਦੀ ਸੋਚ ਰਹੇ ਹੋ ਤਾਂ ਇਹਨਾਂ ਦੀਆਂ 9 ਬ੍ਰਾਂਚਸ ਨੇ ਲੋਅਰ ਮੇਨਲੈਂਡ ਵਿੱਚ ਜੋ ਤੁਹਾਨੂੰ ਸਰਵ ਕਰਦੀਆਂ ਨੇ ਹਫਤੇ ਦੇ 7 ਦਿਨ ਸਵੇਰੇ 8:30 ਤੋਂ ਲੈ ਕੇ ਰਾਤ ਦੇ 9 ਵਜੇ ਤੱਕ। ਕਾਲ ਕਰੋ 6045076666 604 507 6666। ਸੋ ਅੱਜ ਦੇ ਇਸ ਲਾਸਟ ਸੈਗਮੈਂਟ 'ਚ ਮੁੜ ਤੋਂ ਅਸੀਂ ਮੈਂਡੀ ਸੰਘੇੜਾ ਨੂੰ ਵਾਪਸ ਲੈ ਕੇ ਆਉਂਦੇ ਹਾਂ ਤੇ ਗੱਲਬਾਤ ਦਾ ਸਿਲਸਿਲਾ ਸ਼ੁਰੂ ਕਰਦੇ ਹਾਂ। ਸੋ ਮੈਂਡੀ, ਜਦੋਂ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ, ਵੈਨ ਵੀ ਟਾਕ ਅਬਾਊਟ ਮੈਂਟਲ ਹੈਲਥ ਐਂਡ ਵੈਲ-ਬੀਇੰਗ ਆਫ ਆਰ ਫੈਮਲੀਜ਼, what kind of role does culture play over here? Because as you mentioned at the beginning, the nuclear families, the individualistic approach towards, like, now is the time when people have started realizing how much that can have impact on them. So please explain to us in details as to what needs to be kept in mind to have better mental health.
Yeah. So one of the things is mental health affects 1 in 4 people. So that is, the fact. And the thing is, sadly, we have seen in the UK and around the world, people will not go to a proper doctor. Sometimes they will just go to some sort of bubba, whatever, and say oh, here. And they'll say, oh, somebody's done black magic, they've done this. And we need to get away from this out-of-date superstition. We need to look at getting people the right medical help. And like I was saying to you, during this pandemic, people have lost their jobs. People have been feeling very stressed. People are feeling anxious. Some people are now very worried about leaving their house because they've been stuck in their house for nearly a year and their anxiety is through the roof. They don't know what to do. And we need people to seek the right medical help. We also need people to look at meditating, looking at praying, or doing whatever they help them to relax. Sometimes eating healthy and going for little. All these things can help us. And it's about small steps. And it's about, if you have one bad day, that's okay, but look at the next day. And it's really important that we try and look after our well-being. And also we have the ability to surround and support our friends and family at this very difficult time. We're all in this together. This is not just affecting one person. This is affecting people globally around the world. And we have a responsibility to do that.
And there's no doubt, Mandy, what you have said, that this has greatly impacted us, but also people, it has been a blessing in disguise also for many people that now they have started understanding what life is all about. A small virus can stop the whole world. They have started interacting with themselves, spending time with themselves, bringing about the lifestyle changes which they had been thinking of for doing so long, but they had no time. So when it comes to that particular aspect also, how can our culture play a role in this? Because in Bani or whatever scriptures you are reading, everywhere it is written, connect with yourself and understand the true purpose of life. So can this aspect also have an impact for the betterment?
Yes, it does. And I think for somebody like me, it's about following your dharma, following your life purpose, and actually being of service for others. And actually our life is more than just here than building bricks and mortar and things. It's about giving back making a difference. And for me, living a life of legacy and impact. And actually, I've been able to continue doing that through this pandemic and doing it remotely. So whereas before I might have flown to Africa or gone to another country to support somebody, but I'm still able to work. And I think one thing I have personally learned this year and last year is that I don't need as much. And sometimes, you know what, sometimes we get so obsessed with like things that are not that important. And I think for me, self-reflection and finding faith and all these other things have been very important. And I've been able to continue doing the work that I'm doing globally, but from home, and make that difference and still connect. And just like you and I, if Canada, you and I would have sat and you together, but we are being innovative and creative. And again, it is about looking at just checking on people and saying, are you okay? And see what else we can do for people. And if somebody has helped you, please pay it forward. We have a responsibility to look out for people because we are all in this together. This virus does not discriminate what your caste is, what your religion is, what your ethnicity, your gender is. It affects the only difference is if you're richer, you might be able to get a better healthcare system than somebody else. But other than that, it does not discriminate. And I think that we need to look at this and hopefully bring back some good principles and values that we should really all be holding on to.
Right. And Mandy, elders also are the receiving end a lot because earlier they had the opportunity to go to the temples, gurudwaras, interact with their own persons, but now they are confined to the homes. So what would you like to tell, especially our elders? How can they also utilize this time for their betterment?
I think, you know what, it's very hard watching the news, actually, and I don't want to get too much political, but actually, it's been very difficult for our elders over since before Christmas now, watching things happening in India, unraveling and seeing things, especially when people have got their relatives stuck at home and they can't fly back to India and they want to be a part of the things that are happening in India. All I would say is, look, try to find faith, try to take time out for yourself. Try to find a hobby. If you can knit or do something, give back to a charity. Look at doing something else that you can be of service to somebody else. Find a friend and phone them daily. Check in on them, especially if you know and she's living on her own and she's got no family, but you know her number. Sometimes you know what, that phone call is just that's all that they need to stop somebody feeling so isolated and alone. So, we all have a little, and important that we pay it forward.
And in conclusion, on this particular aspect, anything which you would like to add as to what needs to be looked into?
All I would say is, look, first of all, the vaccine is being rolled out. Whatever myths and things you are hearing, it is really important that you seek the right help, advice from your GP or a health medical professional, or if you've got like the COVID task force or people who are sending out the government messages, use that. Do not listen to people who are there to try and make money out of you, to try and say to you, oh, look, it's not real. This is a real thing. And I can promise you this. We have had 100,000 deaths in the UK, so I can tell you it's real. And also what I would say is please look after your health and well-being. You're not alone. We're all in this together. Hopefully, by the end of this year, we will be able to see our loved ones and friends and family and just check and connect with people. And all I would say to people is please stay safe, please look after yourself. And, and to you as well, Harpreet, thank you so much again. It's great to join you again. It's a shame that we're not in person, but, it is the way that the life is at the moment. And we just have to be making the most of these situations.
That's very true. And of course, as far as you are concerned, Mandy, we have seen you recently with Oprah also, and you are using this medium to spread the message of positivity and bring about social awareness in the community. And before I let you go, what are your future plans now? How in the next few months you are planning to reach out to people the way the webinars are happening?
Well, I'll tell you what, I've been booked up to webinars all the way through till November. So, you know what, I don't have time to do things. I mean, like next month is International Women's Day.
Right.
And actually, normally I would be in New York for 2-3 weeks for CSW, but actually I'm doing all of those things remotely. And again, I'm supporting organizations around the world, all the way from Africa to Latin America, from Asia to the UK and across Europe and the MENA region. I'm doing a lot in the Middle East right now as well. I did an event with Qatar in January, again, remotely because I couldn't go there. But you know what? I think like I'm showing people that I'm still able to do my work, and people, want to work with you. So I feel very blessed and grateful that, I'm still in demand and people still want to work. I'm very grateful.
1 second. Great. Mandy, it was a pleasure talking to you. Thank you very much for sparing your valuable time and being a part of this program and spreading this message of hope for everyone. And we are sure your words of wisdom will be beneficial to everyone. Thank you very much and best wishes.
Thank you and God bless you. Thank you. Thanks.
Thank you. ਸੋ ਇਹ ਸਨ ਸਾਡੇ ਅੱਜ ਦੇ ਮਹਿਮਾਨ ਮੈਂਡੀ ਸੰਘੇੜਾ, ਜਿਹੜੇ ਕਿ ਲੰਡਨ ਤੋਂ ਅੱਜ ਸਾਡੇ ਨਾਲ ਗੱਲਬਾਤ ਕਰ ਰਹੇ ਸੀ। ਅਤੇ ਇਸ ਪੈਂਡੇਮਿਕ ਦੇ ਸਮੇਂ ਦੇ ਵਿੱਚ ਜਿਹੜੀ ਉਹਨਾਂ ਨੇ ਗੱਲਬਾਤ ਕਹੀ ਇਹ ਬਹੁਤ ਹੀ ਇੰਪੋਰਟੈਂਟ ਹੈ ਕਿ ਇਹ ਸਮਾਂ ਬੜਾ ਨਾਜ਼ੁਕ ਸਮਾਂ ਹੈਗਾ, ਜਿਸ ਦੇ ਵਿੱਚ ਕਿ ਸਾਰਿਆਂ ਨੂੰ ਇਕੱਠੇ ਹੋ ਕੇ ਇੱਕ ਦੂਸਰੇ ਪ੍ਰਤੀ ਹੋਰ ਦੇਖਭਾਲ ਦਾ ਜਿਹੜਾ ਹੈਗਾ ਸੋਚ ਉਸ ਨੂੰ ਅੱਗੇ ਵਧਾਉਣਾ ਚਾਹੀਦਾ ਹੈਗਾ, ਜਿਸ ਵਿੱਚ ਕਿ ਅਸੀਂ ਨਾ ਸਿਰਫ ਆਪਣੀ ਸਿਹਤ ਦਾ ਧਿਆਨ ਰੱਖੀਏ ਪਰ ਬਾਕੀਆਂ ਦਾ ਵੀ ਧਿਆਨ ਰੱਖੀਏ। ਪ੍ਰੋਗਰਾਮ ਦੀ ਕਰਦੇ ਇੱਥੇ ਹੀ ਸਮਾਪਤੀ। ਤੁਹਾਡਾ ਮੇਰਾ ਸਾਥ ਹੋਇਆ ਕਰਦਾ ਹੈ ਮੰਡੇ ਟੂ ਫਰਾਈਡੇ ਸ਼ਾਮ ਦੇ 7 ਵਜੇ ਪੈਸੀਫਿਕ ਸਟੈਂਡਰਡ ਟਾਈਮ ਦੇ ਮੁਤਾਬਿਕ। ਇਫ ਯੂ ਆਲਸੋ ਵਾਂਟ ਟੂ ਬੀ ਅ ਪਾਰਟ ਆਫ ਦਿਸ ਪ੍ਰੋਗਰਾਮ, ਯੂ ਕੈਨ ਕੰਟੈਕਟ ਮੀ ਐਟ 6046037555 ਔਰ ਯੂ ਕੈਨ ਈਮੇਲ ਮੀ ਐਟ harpreetsingh@gmail.com। ਐਂਡ ਇੱਥੇ ਹੀ ਲੈਣਾ ਆ ਗਿਆ, ਫਿਰ ਮੁਲਾਕਾਤ ਕਰਾਂਗੇ। ਹੈਵ ਅ ਸੇਫ ਈਵਨਿੰਗ, ਸਟੇ ਹੈਲਦੀ ਐਂਡ ਇੰਜੋਏ ਯੋਰਸੈਲਫ।
ਘਰ ਇੱਕ ਐਸੀ ਥਾਂ ਹੁੰਦੀ ਹੈ ਜਿੱਥੇ ਹਰ ਕੋਈ ਆਪਣੀ ਨਿੱਜੀ ਜ਼ਿੰਦਗੀ ਦੇ ਸੁਨਹਿਰੀ ਪਲ ਯਾਦ ਰੱਖਦਾ ਹੈ। ਉਹ ਜਗ੍ਹਾ ਜਿੱਥੇ ਉਹ ਰਹਿੰਦਾ ਹੈ ਤੇ ਪਿਆਰ ਭਰਿਆ ਜੀਵਨ ਬਤੀਤ ਕਰਦਾ ਹੈ। ਇਹ ਗੱਲਾਂ ਤਾਂ ਹੀ ਪੂਰੀਆਂ ਹੁੰਦੀਆਂ ਨੇ ਜਦ ਕਿਸੇ ਜਗ੍ਹਾ ਨੂੰ ਸਜੇ ਹੋਏ ਘਰ 'ਚ ਬਦਲਿਆ ਜਾਵੇ। ਨਵੇਂ ਘਰਾਂ ਨੂੰ ਫਰੇਮਿੰਗ ਤੋਂ ਲੈ ਕੇ ਫਿਨਿਸ਼ਿੰਗ ਤੱਕ, ਡ੍ਰੇਪਰੀ, ਪੇਂਟਿੰਗਸ ਤੋਂ ਲੈ ਕੇ ਡੈਕੋਰੇਸ਼ਨ ਅਸੈਸਰੀਜ਼ ਤੱਕ, ਤੁਸੀਂ SK ਹੋਮ ਡਿਜ਼ਾਈਨਸ ਦੀਆਂ ਪ੍ਰੋਫੈਸ਼ਨਲ ਸਰਵਿਸਿਜ਼ ਲੈ ਕੇ ਆਪਣੇ ਸੁਪਨਿਆਂ ਦੇ ਘਰ ਨੂੰ ਹਕੀਕਤ 'ਚ ਬਦਲ ਸਕਦੇ ਹੋ। ਕੰਟੈਕਟ ਕਰੋ ਸੰਦੀਪ ਕੌਰ 6048259295।
ਜੇ ਕਿਸੇ ਬਿਜ਼ਨਸਮੈਨ ਨੂੰ ਕੋਈ ਪਿਆਰ ਕਰਦਾ ਹੈ ਤਾਂ ਕੀ ਵਜ੍ਹਾ ਹੋ ਸਕਦੀ ਹੈ? ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਦੇ ਓਨਰ ਸੁਖੀ ਬਾਟ ਨੂੰ ਵੇਖ ਕੇ ਇਹ ਗੱਲ ਸਮਝ ਆ ਜਾਂਦੀ ਹੈ। ਇੰਟੈਲੀਜੈਂਸ ਦਾ ਉਦਾਹਰਨ ਇਹ ਹੈ ਕਿ ਕਾਰ ਸੈਗਮੈਂਟ ਤੋਂ ਵੱਖ ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਲੈ ਕੇ ਆਏ ਨੇ ਸਰੀ ਦਾ ਪਹਿਲਾ ਟਰੱਕ ਸੈਂਟਰ, ਜਿੱਥੇ ਤੁਹਾਡੇ ਲੋੜ ਦੇ ਹਿਸਾਬ ਨਾਲ ਤੁਹਾਨੂੰ ਲੋੜੀਂਦੇ ਟਰੱਕਸ ਬਾਰੇ ਗਾਈਡੈਂਸ ਦਿੱਤੀ ਜਾਂਦੀ ਹੈ। ਸਪੇਸ, ਮੋਡੀਫਿਕੇਸ਼ਨ ਤੇ ਫਿਊਲ ਐਫੀਸ਼ੀਐਂਸੀ ਸਭ ਨੂੰ ਧਿਆਨ ਵਿੱਚ ਰੱਖਿਆ ਜਾਂਦਾ ਹੈ। ਸੁਖੀ ਬਾਟ ਟਰੱਕ ਸੈਂਟਰ ਇਹਨਾਂ ਟਰੱਕਾਂ ਨਾਲ ਹੀ ਹੈ ਟੌਰ।
ਵੈਨਕਾਸਾ ਟਾਈਲ ਅਤੇ ਸਟੋਨ ਸ਼ੋਰੂਮ ਇੱਕ ਐਸੀ ਥਾਂ ਹੈ ਜਿੱਥੇ ਤੁਹਾਨੂੰ ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਤੇ ਹਰ ਕਿਸਮ ਦੀਆਂ ਟਾਈਲਸ, ਸਟੋਨ, ਮਾਰਬਲ, ਬੈਕਸਪਲੈਸ਼, ਮੋਜ਼ੇਕ ਆਦਿ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਮਿਲ ਸਕਦਾ ਹੈ। ਇਟਾਲੀਅਨ, ਸਪੈਨਿਸ਼, ਚਾਈਨੀਜ਼ ਪੋਰਸਲਨ ਜਾਂ ਸਿਰੈਮਿਕ ਟਾਈਲਸ ਜਾਂ ਮਾਰਬਲ ਸਪੈਸ਼ਲ ਆਰਡਰ ਤੇ ਜਾਂ ਕਲੀਅਰੈਂਸ ਤੇ ਲੈ ਸਕਦੇ ਹੋ। ਮਾਲਕ ਡਾਇਰੈਕਟ ਟਾਈਲਸ ਇੰਪੋਰਟ ਕਰਦੇ ਹਨ, ਜਿਸ ਕਰਕੇ ਵਧੀਆ ਕੁਆਲਿਟੀ ਦਾ ਸਮਾਨ ਤੁਸੀਂ ਆਪਣੇ ਘਰ ਦਾ ਸ਼ਿੰਗਾਰ ਬਣਾ ਸਕਦੇ ਹੋ। ਅੱਜ ਹੀ ਵਿਜ਼ਿਟ ਕਰੋ 130428 ਐਵਨਿਊ ਸਰੀ। ਪੰਜਾਬੀ ਹਿੰਦੀ ਵਿੱਚ ਗੱਲ ਕਰਨ ਲਈ ਕਾਲ ਕਰੋ 604 330 7363 604 330 7363।